the group of scientists who would cover some of the issues. I will spare you that. They are going to do that. That is Dr. Mary Kawonga and Professor Bruce Melado are going to make some presentation immediately after this to indicate where the national picture is and what the impact of it was is something I will spare you, again, because it is going to come from them relative to the Gauteng province. As we speak now, we have 50,000 active cases in Gauteng province. Active cases are a very important measure of the pace of the pandemic, and this we do. It was 46,272 cases before yesterday's latest figure, and today is 50,000 cases. We are second to KwaZulu-Natal in terms of the number of active cases. We have just surpassed the Western Cape. This is an indication of where the province is going. So although in my input you would have data, a narrative on modeling and the epidemiology of COVID-19 in Gauteng, that presentation is going to be done by the researchers after this. I want to say that science is extremely important. The reason we have appointed the advisory committee at a provincial level to help us just focus on the specific trajectory of the pandemic in Gauteng is to ensure that, like our national government, we also respond in our program and campaign and battle against COVID-19 based on very specific nature of our province. And again, I want to repeat that we are a densely populated province. 1 in every 4 South Africans live in Gauteng. Dense settlements, human settlements, are a great source of concern, and a lot of infections take place in those dense settlements. Huge intermodal transport nodes where people interact in large numbers as they go to work and go about their business. Understanding the nature of our province has always conveners, the mayors as well as the MMCs for health. So this afternoon we have a meeting immediately after this briefing. The work of the district councils is also guided by the research and the evidence that is showing where is the pandemic moving, where do we have more hotspots, where do we have a lot of activities that are violating the protocols, where do we have people not complying in larger numbers. So the work of the Command Council at a provincial and district level helps to reinforce that, to focus that. We also have the ministers and deputy ministers deployed by national government, by the president. They work with us in the provincial command councils, and some of them are assigned to various districts. You must know that Gauteng is largely a hotspot area. The 3 metros are hotspots areas as declared on the 28th. But as we speak now, we are principally a hotspot as a province. And those, it's only one area of our province, that is Sidibeng. So that was the case during the first wave. Sidibeng came last. But you first have the metros in increases, and then you followed by the West Rand because of the dynamic of the West Rand economy with a lot of mine workers that move in there. It is that time of the year now. People are moving from the different parts of the country back to the province for work. And those who live here, we are expecting also that we are going to see increases in the West Rand on the basis of people returning to work, especially in those mining areas in the West Rand. So the district command councils are very important. They get supported. And then the executive council of the province then meets when decisions have to be made. Coming out of these processes, if we have to make decisions, allocate resources, escalate here, step up or in one area or downscale in another area, we do so in that way. So provincial coordination is important, extremely important, and then science and evidence, absolutely important in that regard. This is how we have approached the first wave, and we kept improving on that throughout. So again, now if you just look at the how infections we had on the first peak. For example, on Friday, the 8th of January, our province recorded 6,959 new cases just on that day. So that is the highest point we have had. We have been saying that in the last 7 days, the infection rate has been increasing at a high rate. It has been doubling, but there are also other indicators I'm going to take you through to show where else have we getting increases. Infection rate, it has come down a little bit to 4,200, and I know even based on in the last 2 days in particular, the numbers have come down both nationally and provincially, come down slightly, but we don't want to be complacent. That's not yet a trend, because we expecting that having had so many people returning to our province, we're expecting that we are still going to experience, given the nature of the new variant and the intensity of the second wave, we're expecting that we're going to shoot to the roof in this. This also, of course, is going to be impacted positively by the level of compliance with level 3, which we welcome. The president announced staying on level 3 yesterday. As a province, we support that fully because we couldn't imagine the restrictions being lifted. We support that. We have not yet seen the impact of level 3 restrictions. The scientists say it takes a little bit of time to start seeing a lot of positive impact on at least the first impact we have seen is about hospital admissions in trauma units. That we saw immediately. The number of people in trauma unit for New Year Eve was the lowest ever since. And in some hospitals like Chris Hani Baragwana, not the lowest ever since the pandemic, but the lowest. They didn't have any admissions. But we're expecting that the real impact of the level 3 measures will be seen later. What we are feeling now is a combination of, number one, the interactions that people had in December, especially mid-December to Christmas, in the run-up to Christmas. We had lots of places where gatherings were taking place, and I explained this, that in some instances, young people were the drivers of this, partying, including in some instances just where young people just came together violating regulations on highways, R80, Mawapani R80. It's an example of that. And the message to young people is that COVID-19 is, especially the second variant, is also very deadly. A lot of young people, the hospitals are reporting to us that a lot of young people are also getting admitted in hospitals. And it is important that we say to young people, please take care of yourselves. You are not only taking the virus to your homes, but this virus is also very impactful with regard to you as young people. It is also important to indicate that the new cases on a 7-day average, you can see that the cases are going up, except, just the brief on the 10th decline fewer cases. But I want to emphasize that we want to warn that this is not yet a trend. But over 7 days, you can see up to the 10th of January, over 7 days, the number of cases have been increasing, essentially doubling up. But if you see the trend in Gauteng from the 1st of November, we have had moderate infection rate, daily infection rate, and it's from December that we started seeing the increase, the 10th of December. And as we got to Christmas, the increase was being recorded more. And as we speak now, we essentially have doubled the numbers over the last 7 days. It's double. So especially in terms of, so the number of people who are testing, more of them are getting positive results, which is an indication for us of just the prevalence of the pandemic and why it is important that we must take precautionary measures. Another indication that you have to look at, in addition to daily cases, whether they are increasing or declining, is hospital admissions. We would like to say that we have had a stable level of number of hospital admissions in our public facilities. That has been very stable until we got to December. The number started to increase again. There was a period, essentially at the peak of the first wave, where the number of hospital admissions, particularly in public hospitals, were highest at over 3,106. When we combine both private and public at that time, there was a period at the highest point of the first wave. That means at the peak of it. We had more than 7,000 hospital admissions. And here, we're talking about both in the private and in the public sector. But what we are giving you today is just an indication of, with public sector numbers, our numbers have just at the beginning of January, we were as low as 700 hospital admissions. In the public sector, those numbers have doubled to over 2,400 as we speak. Over the last 7 days, the numbers have, in fact, they've tripled to over 2,700. If you ask the question, what's happening in the private health sector, I'm going to show you a slide that shows that the private health is also not coping. We are coordinating, we are working together. In a number of instances, we have also admitted in the public sector some of the patients from the private sector. But we are reaching that level of seeing significant increase in hospital admissions. We are not yet at the level where all our hospitals are full, but the last 7 days has given us a sense that the numbers are increasing quite rapidly. In terms of, another indicator is the fatality rate. Our overall fatality rate is still at less than 2%. That's 1.8%. That's the overall fatality rate in Gauteng province. But when we just do a comparison week per week, we are seeing that the number of people succumbing to COVID-19 is increasing quite significantly. In the last week of December, it has increased by 123%. In the week that follows, right up to the early January, it increased by 155%. And as we speak now, it has increased just by 10%. So we are recording quite significant, in a week, losses of life, quite significantly. As you have seen that there was a period early on when the pandemic has stabilized where we had 69 deaths per week. Now we have per week up to 433 people who succumb to COVID-19. But this is per week. If you compare to where we were at the peak of the first wave, there was a period where we had 200 people who succumbed to COVID-19 in one day. We are not yet, in terms of fatality, we are not yet where we were at the highest point of the first wave, but we are deeply concerned about the number of people who are succumbing to COVID-19. I want to repeat, at the peak of the first wave, we had a significant increase to a point where in one day in July, we did lose more than 200 people in one day. At the moment, our average fatalities per week is 433. This is a matter of great concern, but we are not where we were. You would see that at the peak of the pandemic, we had 578 people succumbing to COVID in 1 week. We have excess deaths that Dr. Mary Kaonga is going to explain what the excess deaths are. I don't want to talk about this area. It will be explained adequately. Professor Bruce Melado is going to explain the modeling of the pandemic. If we did not have level 3 introduced on the 28th of December, where will Gauteng be? If we went to or stayed at level 1 in December, where will Gauteng be? Professor Bruce Melado says the modeling team, the group of scientists that are doing modeling says we could be at 90 active cases. You remember I started by saying we have 50 active cases at the moment. So our modeling team says if we stayed at level 1 in Gauteng, we could be double the number of active cases. This is modeling, of course. And they're saying that there's still more results we will see from the positive impact of level 3, the introduction of level 3. And in the slides that we have in here for you, it shows that with level 3, the infection rate is less than what it could have been. But this infection rate is increasing. That's why I said it is at 50 active cases at the moment. But it could have been at 90,000, that 50,000. It could have been at 90,000 if it wasn't for the level 3 intervention. So these interventions related to alert levels, in Gauteng province, we can say there's evidence, although the full impact of it is going to be felt in a week or two, but there's evidence in some areas already about it working, which also means the reason to continue with these measures of level 3 as announced by the president, we have the evidence for it, that if we just lifted level 3 or went back to level 1, the situation would be much more difficult than what we are seeing now. At the moment, we are concerned with the increases, but level 3 is going a long way in reducing the pace of the infection rate, particularly driven by the infectiousness of the new variant. So Bruce will also talk about the hotspots. Let me say something I said yesterday when we were at Steve Biko Hospital. Tshwane, the Tshwane Metro, and that is the district, there has been the first key driver of the second wave. And we looked in December. The first impact was principally about the event of the matriculants who went to Durban. The largest number of them came from Tshwane. We explained what we were doing to do tracking those and isolation and ensuring that they are tested and their contacts are done. But that had an impact in why Tshwane is leading in this regard. But also there were a number of super spreader events that took place there in that area, quite significant. And when we say that we appeal to the people of our province, don't go out there, don't hold super spreader events, please comply. There's evidence that comes later. So the biggest pressure at the moment, the hotspots we are seeing, the largest number of those are in the Tshwane Metro. We are working with the Metro to ensure that we address these issues quite substantially. But this is spreading. It is in Johannesburg. It's both in the townships and in the suburban areas. So the second wave, as it's unfolding now, as these numbers are doubling, it's not just confined to certain spaces. So you have hotspots that are in the city centers, and then you have hotspots also in the townships. There's no part of the province that's being spared. The number of infections may be fewer in certain areas. Professor Milado will speak about this once I conclude. So you'll see those hotspots are again going back to everywhere. How are we responding to the hotspots? So the value of this report, to track the hotspots, to track where the infections are happening, is to guide our tracking and tracing and testing teams on the one hand, so that they are directed. They need to go where they know there's evidence that the pandemic is on a rage there in those areas. So we use hotspots tracking to direct our healthcare workers, to direct our tracking teams, by also direct mobilization, which is the second area. In addition to doing tracking, tracing, and testing and isolating people or those who need quarantining, the second approach to dealing with hotspots is the ward-based response teams. So we have a team convened at a provincial level led by MEC Lebogang Maile, the MEC for Kokta. That team is to drive a program for every ward in Gauteng. We have the councillor in the ward being part of a war room. Of course, at the moment, it's not all the wards. I think there are wards where the councillors have cooperated with the command council team very, very well, but there are areas where there isn't. The main intention of this ward response teams and ward war rooms is to go into areas. If we identify a street where people continue to break the regulations, or there's a funeral in the area and there's no compliance, these ward response teams are working with the affected communities and the law enforcement agencies and our healthcare workers to look at what we're doing in the hotspots. In some instances, if we have an establishment that's not complying, if there's a retail or a supermarket that's not complying, these teams are also make sure, so we are combining the law enforcement side, but with community mobilization, but also with getting people really to enlist themselves to the campaign. We don't just want this to be an enforcement by the police, but it must also be about enlisting people's participation, civil society, the religious leaders. In this regard, also the various community leaders, including the leaders of political parties in our province. This morning, I met with the leaders of political parties represented in the legislature to brief them on where the pandemic is, to share this information we are sharing with you, but also request their inputs, because we can only succeed if we mobilize everybody. This is not time for politicking. This pandemic is harsh. If we spend time quarreling amongst ourselves as political parties, and I want to say the same with the unions, it's time to really, really pull our hands together. Our MEC for Health has been meeting with all the unions. She's completing those meetings. The last meeting is today, to say to all the unions, we need you on board. As we mobilize everybody, we need you on board, because the unions represent workers. We must deal with all these issues together, and this is not time for politics. Those who want to spend time involved in politics, we have no time for them. We want to focus on the pandemic. That's our immediate and most important concern. So essentially, given the fact that Gauteng is now in the midst of the second wave, which has a more infectious variant. So what is it we need to do? Firstly, I want to repeat that we welcome that the country is staying at level 3. And therefore, we want to build on the level 3 measures. The first thing is to continue social mobilization for adherence and behavioral change. And I've explained how are we doing that. Work with everybody to contain the transmission rate. And the second thing is to ensure level 3 has also still made prohibitions for super spreading events, but it's one thing that they are not allowed. We know there are areas where people organize these events, including those who continue to sell alcohol underground, hold prohibited activities that spread the virus. But we want to make sure that through enforcement and mobilization, we reduce the impact of super spreader events. We are also scaling up testing and tracking. Just in the last 7 days, you saw us on the roads in Gauteng Province, where the police have been doing roadblocks, and the healthcare workers have been doing testing on our roads. Though the increase in testing is extremely important, but also our tracking teams have also, some of the people who had gone on holiday, who are in our tracking teams, have now come back. The intensity of tracking is also increasing as we upscale testing as well as isolation. This is an important way. We have learned this lesson from the first wave, that more testing and tracking is useful so that we know the prevalence in a particular area. If the pandemic is really, really raging and almost everyone is impacted there, we then know what is the response of our health services in that area. Is there something more we need to do? Can we ensure that we clear some of the facilities in an area that is hardest hit, and see where we can move some of the admitted healthcare workers to ensure that the health institutions and the health facilities respond based on evidence. They respond. So we basically tracking and chasing the pandemic. Where there are more infections and more people are sick in an area, we want to ensure we have more hospital beds in those areas. And the other important thing we are also doing is increasing the number of, we are continuing to increase the number of beds. The staffing that we had during the first wave, we took over more than 400 health professionals. We also got additional nurses from the National Health Department. We want to retain them. We had gotten these health professionals on the basis that the coronavirus pandemic is going to change in 2021. So they were on contract up to the 31st of March. We have now decided as the Gauteng Command Council that the provincial government, that's the Executive Council, must help us to find the money to retain these health workers. And this includes doctors and allied health professionals. It includes the nurses. We want to retain them as we deal with this difficult period. So the one clear question about what we are doing to ensure that the capacity is there. At the peak, we didn't use all the capacity. At the peak of the first wave, we didn't use all the capacity. We're going to need, from a staffing point of view, we're also increasing access to oxygen. There's a team led by the acting HOD, which has also been engaging with those who provide oxygen, medical oxygen. The MEC briefed us that that team has been engaging to ensure that we expand capacity. We don't want to run short of oxygen supply. That's the lifesaver. And this also include increasing oxygen points at some of our sites like Nasrec. In terms of I want to deal with the number of beds later. I'll indicate exactly. So I'm talking about staffing. We will retain the number of doctors, nurses, and allied health professionals that we recruited for the first phase. We will retain them. Their contracts were going to end at the end of March. We will retain them because it will help us to phase up to this. We need them for the additional beds that we now have, which we didn't have at the point of the first wave. And I'm going to talk to this additional beds in a minute. So there's still more data that I would like to share with you, but I will leave a lot of information to Bruce and Mary. But this one I would like to share with you just to give you an indication. Earlier in the week, we had the admissions as follows. Hospital admissions where I said to you earlier on, the number of people admitted in our hospitals by weekend was 4,400. As I speak today, the number has dropped to 4,128, a little bit of reprieve. So we have a little bit of reprieve, but it is still high. 1,300 of the admissions are in the public sector. I said to you earlier on, we had 2,400 admissions in the public sector, but the number has dropped slightly. The number in the private sector has increased to 2,787. So you can see what happens. There's movement in terms of the number of admissions in both the public and private sector. Increases and decreases. As I say, when we have more available beds, it helps us. And you will see in the report that 220 people are on ventilation as we speak, 220. 384 are on oxygen. And then there are those who are on room air and other support systems. We watch this number of how many are on ventilation very, very closely and how many are on oxygen, because that's where critical care interventions are required. And when they improve, they get moved to the general wards. And I will share with you how many general wards do we have versus how many critical care wards do we have in our province. So, as I say, we have a little bit of reprieve in terms of the admissions in our hospitals. Just over a period of 4 days or so, our situation has improved. The number of hospital admissions have dropped slightly, but you must understand that as we have more infections, we are going to experience more hospital admissions. That there's a directly proportional relationship between the number of people infected. The increase in cases will lead to the increase in those who need some care. So it is too early at the moment to say that the situation is better, because we are not even at the peak. We are just starting the high road. We're starting to walk the high road in Gauteng province. We are giving you information about hospitalization cumulatively since the start of the pandemic. All those numbers, including those that have been discharged, it's important to share with the people of our province. There is a picture that, again, Mary will talk to about daily changes in hospital admissions, but I've just given you the cumulative picture that we have less over the last 4 days. But if you look at a 7 days period, the number is still high. So we have a dashboard in Gauteng which helps to indicate and share information with the public. That dashboard indicates what's happening with regard to bed management, and this is information that is accessible. We want to continue to share with the people of our province on what's happening with hospital admissions in our province. The indication of this changes on a daily basis. Sometimes even in 5 to 6 hours, the numbers change. So by evening, then these numbers may have changed about how many people are admitted and how many are released, discharged, and have recovered. The one important thing we want to say to you, we have a lot of people or patients under investigation who are occupying some of our hospital beds. Now, patients under investigation are people who have arrived at our facilities. Some of them they will have symptoms. They will say, I have this problem or that problem, my sore throat, or some even may be able to say, I have breathing problems. They get tested first, those who don't have test results. They get tested first because if someone has been tested, they get clinical attention, and the doctors are able to know this person needs this type of support. They must be put on oxygen, or they must be put on just oxygen support, or on a more serious clinical intervention. So at the moment, we have a lot of PUIs, patients under investigation. And part of it is because the testing is taking a little bit of time, and this is a matter we are resolving. We want, as people as test, you don't want people to be waiting for test results for long, because as they are waiting and they don't know their test results, it is also a risk. It increases the risk, but they're also occupying some of the beds that need to be occupied by those who have been diagnosed, who need treatment. So what are we doing with this? So we are managing the PUIs, patients under investigation. We are managing them. Some of them are also being brought at NASREC for our quarantine facilities. We are also going to be using NASREC for that. But others are the people you have seen are in the fever tents. Those fever tents were very useful during the peak of the pandemic, during the first wave. Those fever tents are just to help us deal with people, the patients under investigation, and that's what they have been able to help do. They are not the place for optimal and adequate treatment, because once people are cleared and they are diagnosed, they then get transferred into appropriate wards by the clinicians based on what their indication is. I have spoken about mortality, so I just want to spend a little bit of time now talking about the bed situation. I think this is extremely important to say that before the pandemic started in Gauteng, we have always been planning about improving some of our facilities, but this pandemic has helped us to do the following as we speak right now. We have been able to increase the number of beds in Gauteng province from, that is general and critical care beds, from 1,925, where they were 1,925 before the pandemic. And then we have additional 2,419 beds. We added 2,419 beds, and this takes you to 4,344 beds. So we have added, as I said, as I speak right now, we have additional 2,419 beds, but this is not this is not the completeness of the number of beds where work has been done on and is being done on. But those ones are done. As we speak now, these are the beds that are being used to service members of the public in the public healthcare sector to help us respond to COVID-19. And the baseline increase has been significant. It gets quantified there. In addition, as we are speaking now, there are additional beds that by the end of January, we will have an additional 375 beds plus 150 beds. So that's 525. So by the end of January, we will add, in addition to the 4,344, we will add another 525 beds. This is the work, ongoing work in response to both the first wave, but also we started also looking at more creative ways in partnership with various sectors in preparation for the second wave. So anyone who says no, we are less ready for the second wave than for the first wave, they are not aptly accurate about the assessment. Firstly, with regard to the number of beds, we have more beds. Secondly, with regard to the staffing, we have more staffing. But can we do with this? And that's where the critical challenge going forward is, of poor contractor performance, and the action has been taken together with the police where there have been disruption and stopping of projects. This is a perennial problem in Gauteng. We experience it in school building programs and infrastructure projects. The police have helped us a lot. There were disruptions at George Mukari, where we are continuing to add beds there. There were disruptions. So Bronkhorstspruit Hospital's upgrade improvements is taking place now. Before the end of January, we will hand it over. It's our partnership with BMW. It is going to be a useful facility to help relieve the pressure on Mamelodi, and in partnership with Steve Biko, relieve the pressure on Mamelodi. So the 150 beds at Bronkhorstspruit Hospital, the 300 beds at Jubilee Hospital, and the beds that are being completed at George Mukari will help a lot in the northern areas of Gauteng. In the southern areas of Gauteng, including Johannesburg and parts of the Vaal, and I've already spoken about the West Rand with regard to the Anglo Gulch Ashanti, the delay that is there with that project. There are beds that are complete. We are confident that the work that our infrastructure department is doing right now, just to make sure that, and health providing the staffing, we will have, for the people of the West Rand, a facility in the West Rand that what we didn't have before. So the build program will continue. Another 375 beds will come on stream in February, so that we complete our build program. So the number that I've just mentioned of 375 plus 150, which is 525, is for the month of January up to the end of January, and there will be additional beds. I want to say that in addition to those, we are looking at NASREC in a different way. We were under pressure after the peak of the first wave. We were under pressure from some of the parties that NASREC should be closed. We took a view, and it was a necessary risk we took. We said, no, we can't close down NASREC because the behavior of the pandemic may change. Instead of closing it down, let's downscale the number of beds. We downscaled from 1,000 critical care beds to 500, and we kept the quarantine beds at 500. So as I speak now, we are upscaling NASREC again. So we are going, those 500 beds at NASREC, which we have downscaled with oxygen points, take 2 days only to bring back up. So we will have another full 1,000 bed at NASREC for critical care with oxygen points. We will also have we are also having a 500 beds that will help us. Those beds are helping us to deal with the PUIs at Chris Hani Baragwanath and other hospitals. I said to you earlier on that patients under investigation are occupying the beds that need to be occupied by those who have already been diagnosed. So we will also use the quarantine beds at NASREC for the patients under investigation. This is being coordinated by Chris Hani Baragwanath. The clinicians at Chris Hani Baragwanath are coordinating this operation. But I also want to add that as the pandemic rages, we are monitoring very closely. Should we need an additional 1,000 beds at Nasrec? In addition to what I have explained already, because Nasrec is our only field hospital. Should we need those? And all indications are that we will need them. Should we need those, we are going to, our team of health is working with the infrastructure department to ensure that we can have, as the pace of the pandemic increases, and as the infections and the hospital admissions increase, we can have another 1,000 beds. If you take all that together, the conclusion is that we have better capacity at the moment to face the second wave than we had in terms of the number of beds as well as the number of the personnel and also health technologies. Remember, these additional beds go with health technologies. That work has been happening throughout by the Department of Health in our province, in increasing health technologies, bringing in, connecting the required equipment, making sure that there's enough oxygen supply, making sure that there are oxygen points. It's an ongoing work. But the question, so we have better capacity, but we do not know how raging and how deep the pandemic will go in terms of the increases. We do not know. And that is why we can't just rely on how many beds. So even though we have essentially doubled the number of beds we have had before, and we are increasing those this week, and will also increase, put additional ones in February. As I said, they are coming into stream. Basically, these are not new projects, they are coming into stream. Even with that, we want to say to the people of our province, without non-pharmaceutical interventions, we may not even be able to cope with the pressure. So on behalf of the healthcare workers, we are saying the availability of beds is important, but we must also continue to ensure we implement the health protocol so we don't further overburden the current capacity. And I want to emphasize that although we have doubled the capacity we had before the first wave, but just given what the indications are that the second wave is going to be more in all indicators, we would like to appeal to communities in Gauteng to help our healthcare system by continuing to sanitize hands and wash hands, by continuing to wear masks, and by continuing to social distance, and by staying away. If we can afford to do so, let's not go to funerals in the way we used to do, unless it is a family funeral, at which there should also be very, very careful considerations and measures. Alcohol, with regard to alcohol ban, the president announced that the suspension of the sale of alcohol continues. That will help us, and the evidence is there. So we are not going to have a lot of trauma units and the trauma healthcare workers that are focusing on people who are admitted there as a result of alcohol abuse or conflicts or fights or violence or accidents on our roads. That has helped a great deal. I will share with you information on the accidents, what has happened on our roads with regard to law enforcement. So I want to emphasize, we are continuing as we approach this raging second wave. We are continuing to improve. We have better hospital capacity. We are continuing to improve with regard to the numbers, but we also want to make sure that with regard to PPE, we have sufficient PPE. So there is a slide that indicates the MEC is paying close attention to the PPE story. One thing is we don't want to go back to the phase where PPE corrupt projects from ArcelorMittal, but that matter was resolved and we are back on track. So what is our law enforcement picture? You have all seen the police working on our roads, on the roadblocks, crime that have increased. And that's we're talking here from the start of the festive, housebreaking, those type of crimes increase usually during the festive season. Those have remained stubborn. Cash in transit heists also have stubbornly remained, whereas other types of crimes have declined. But I must also say, with great deal of concern, gender-based violence, even in the period of high intensity of law enforcement, gender-based violence has stubbornly remained a great deal of concern, has not decreased, because this takes place in homes. So this is something that we'll continue to pay attention to. The alcohol restrictions have reduced the number of people admitted. We are repeating this story. The number of people admitted in trauma wards has drastically been reduced. We must also report that more people are now wearing masks, especially in public transport. The roadblocks have told us a story that there's lots of compliance in public transport on our roads, but we know when people get out of the places where they know there's monitoring, they kind of take off the masks. We appreciate those who continue to put on their masks, but I think it is important that we say to the people of our province, we are not wearing masks for the government. We are wearing these masks, we are washing and sanitizing our hands, not for the government, but we are doing so to protect our loved ones, those we interact with, our work colleagues, those we interact with every day. We are also doing so as our contribution to slowing down the pandemic and containing the spread. And there are those who, in return, wear the masks are protecting us. So the one thing about COVID-19 is that it requires both us to hold hands. If someone does it and the other one doesn't do it, it puts all of us at risk. So we commend our law enforcement officers, but the story is that a lot more of them have also contracted COVID-19 in the last 2 weeks. The police have reported a lot more officers have contracted COVID-19. This is the same with our healthcare workers. A lot more healthcare workers have contracted COVID-19 in the last 2 weeks, in the run-up to Christmas, in the festive period, and in the last 7 days. And this is also impacting on our response capacity. And this is something that the leadership of the police and the leadership of our healthcare system is managing. I want to say the health workers who did not take a break during December, and there are many of them who are going to take a break now in January. The discussion that has been taking place is to say that given where the pandemic is, this discussion has been taking place at hospital level. And I've said to the MEC, also engage the unions. Let's make sure that we have as many of the healthcare workers as possible. We understand a lot of them are fatigued. They work throughout the festive season. The same with our police, men and women. But this is just Gauteng's turn. We saw the pandemic was raging. It was causing havoc in the coastal provinces in the period during December holidays, and we have to face up to this challenge now, especially in the next 2 weeks. We are going to go through the eye of the storm. By all account, we have better resources than we had before the first wave, but if the evidence points to the fact that this second wave is going to be more demanding, it is going to be putting more pressure. It is something that we have to deal with to understand that it is almost a zero-sum game. I want to conclude by talking about education. The focus of our education department currently is to look at completing the marking of the exams and preparing for the opening of schools. There were problems with the marking of the exams because some of the markers decided that for various reasons, including others who may have contracted the virus or were positive, or others just feeling that it's not safe, the department had to replace those ones. So the marking is happening at the moment, is going on, and the department is preparing for the reopening of schools in the new year. But one of the key issues that we're hoping will be dealt with by national government is that Gauteng is going through the eye of the storm. So in the next 2 weeks, our province is going through a period where the increases in infection will continue to rise. The spike in infections will continue. So we must reduce the potential of places which will serve as inflection points. We must reduce the potential of too many places, including in the next 2 weeks, about how many. We don't want a situation where our schools become a critical area of concern. This matter is being dealt with by the National Coronavirus Command Council and the Minister of Education. We hope to hear from her. But Gauteng, the schools, the reopening of schools in Gauteng, which was supposed to happen in the last week of June, is coming at a time when we are on an upward trajectory with regard to the pandemic. So it will definitely have an impact, and the department is planning for all various possibilities so that should we lose some time, we will be able to catch up, and that's something that we will deal with. So at this point, I would like to pause and say that it is important that the people of our province, people have come back in Gauteng. We have larger numbers of people who have traveled all over the province, all over the country. Some of the people who are arriving are themselves just arriving to immediately get admitted because they got infections elsewhere. Bruce and Mary, just to present the evidence from the modeling team and the advisory committee on what these numbers really mean. And then I will be able to take questions as usual once we are done. Thank you very much. Vuyo and Thabo.
Mary, are you able to present?
Premier, for that comprehensive report. We had a bit of a technical glitch. I hope it has been sorted because both Prof. Milado as well as Dr. Kaunga said, it has actually been sorted. So I just want to affirm that if that is the case, Dr. Kaunga, if you can hear us, and if you can hear us, please do proceed. And if not, Premier, you'll have to be the scientist and take us through. Okay. That's fine.
I can hear you now.
Can we just get an indication?
I think we have a presentation. Prof. Malado is lighting it now. Can anyone hear?
Yes, we can hear you talk. You can please proceed.
Yes, we can hear you.
Okay, all right. Thank you very much, Premier, and good afternoon, everybody. So what we're going to do, I think, in the interest of time, we had some technical difficulties, but what we'll do is we'll make a presentation. Prof. Malado will present, really just to consolidate the issues that Premier has been speaking about. Starting very briefly with a bit about the epidemiology of where we're at with the pandemic, And I think Premier already presented some slides showing the trajectory is still upwards in Gauteng. So whether one looks at cases or mortality or hospital admissions, it's definitely an upward trajectory. But the thing that we want to focus on right now is the predictions from modeling that have been done, and Prof. Malado will present those.
Yes, please proceed, Prof.
Yes,
please
I can hear you.
Prof. Go ahead.
Okay. Okay. Thanks for having me. Thanks, Premier. As already indicated by Dr. Kawonga, I'm going to dwell on the issue of where we stand and putting everything in perspective and try to understand where we are going. And I will talk about in a bit more detail about the issue of hotspots and where those are appearing, following up on the presentation by the Premier. So on this slide here, on the upper graph, you have the number of daily occurrences of the virus, and obviously it's clear that we are in the middle of the second surge. Unfortunately, we're not yet reaching the peak as we keep growing substantially, and I will show a couple of slides where we will illustrate where we stand in the big picture. So let's look at the graph below. The graph below gives you the number of cases over a week and the average over a week, where unfortunately the number of cases in this past week has increased faster than the previous, which is consistent with our expectations that a large number of travelers were going to go back bringing virus from other locations. So that's certainly a very serious source of concern that we need to keep an eye on. So let's go to the next slide. So let's dwell on this slide a bit here. Let's concentrate on the green graph. That's the number of active cases. And as you know, the adjusted level 3 was put in place December 29th, as announced by the president. What you see here is that had that level 3 or adjusted level 3 not been reinstated, the number of cases would have been significantly higher. So we now have sufficient data, and the green points to the right is the data basically indicates that level 3 restrictions have certainly slowed down the pandemic. We are right now around 50,000 active cases compared to about 85,000 hadn't the level 3 been implemented. Now that's the good news. Unfortunately, the downside is that the numbers are still very high, and we can't certainly relax nor relax as obviously the population as a community, nor relax the non-pharmaceutical interventions, as you will see in a minute. So as a result of the fact that a level 3 has been reinstated, we basically had to create a new set of predictions and a new set of calibrations based on the data that we see, and that's what you see here. Let's concentrate again on the green curve that was obtained last week. The numbers that we have been seeing the past few days, what we observe in terms of the rate of hospitalizations and mortality are very similar to that of the first surge. This implies that the impact of the second surge is going to be significantly higher. And it basically scales with the number of predicted cases. So we put here the predictions. This is the green dashed line compared to the peak of the first surge, seeing that we expect to be significantly higher unless a change in the dynamic of how the virus spreads is affected. Let's go to slide 5. Now this is the description of a hypothetical situation. As you know, the president announced that level 3 restrictions will still remain, but this graph basically tells you that if we were to consider a hypothetical situation whereby level 3 restrictions will be released to level 1, we would have seen a significantly faster increase in the number of cases, as detailed in the orange curve. Now, this is now hypothetical. Obviously, it's not going to happen because level 3 will continue, which basically is one of the reasons why it's basically very difficult to release the existing level 3 restrictions. And this can be explained very easily by the fact that we still have a significant fraction of the population that can be infected. If you release the restrictions, then what happens is that the chain of transmission will allow the virus to go faster, involving a lot more people at any given time, overwhelming the healthcare system. So it is critical that the existing adherence and the existing non-pharmaceutical interventions remain. Now let's move on to a topic that the Premier has already touched upon, which is extremely important. One thing is to see how many cases do we have, but it's important to see how they are distributed, where are they, and how the different hotspots are moving around in the province. That's extremely important for both policymakers and the population to understand where the virus is and where to act correspondingly. So in collaboration with IBM, we have developed a public tool that can be accessed by anyone in the country or in the world for that matter, that displays the location of the active hotspots, meaning these are clusters of active cases that have not reached their peak, so they are a source of concern. Currently, we have experienced in the province a significant increase over the past week or so of the number of hotspots. This is a sign that the peak hasn't yet been reached. If you look carefully at the characteristics of the first surge, we saw that as we were approaching the peak, the speed or the rate with which new hotspots were being created was already slowing down. We don't see that at the moment, and that's a serious source of concern. Right now, we have about 300 active hotspots with cases ranging between 100 cases and up to 1,000, slightly above 1,000. Some of those hotspots correspond to testing stations, but it's important to have them on the map so that people understand that that region certainly has quite a number of cases to raise awareness. The bottom line here is that the virus is spreading fast. It's not discriminating. It's really going everywhere where there is people to infect. And unfortunately, there's many hotspots created daily. So this is a very important tool to raise awareness about the fact that the virus is real and where it is at the moment. We provide tables with the location, the ward ID, the areas that are affected, the type of hotspot, the number of cases, and very importantly, the risk index or the index of severity, which is a number that quantifies how serious the hotspot is, how serious the cluster is, how fast is it spreading? Is it spreading exponentially? Is it a recent spread? Is it inconsistent with previous trends, indicating a very rapid growth, etc., etc.? That's what that number is basically showing you, and it helps policymakers and the population understand the severity of the hotspot. And as it is explained on the tool and online, that a number above 20 typically indicates that the hotspot is a dangerous one. I'm going to give you some an indication of some areas where we have a significant number of hotspots and clusters of hotspots, as already indicated by the Premier. This is an update that adds the very latest data. I'm going to go through some examples of areas with high density of population that are currently undergoing a serious growth in the activity. One of them, for instance, is Atterichville in Swane, and is basically showing here that the entire area now is has quite a number of hotspots, and also the color indicates the severity of it. Some of them are quite severe. That was in Swane. Another area with a lot of activity is Soshanguve in Swane. You can clearly see the hotspots emerging in a relatively large geographical area. Another area that was not very active in terms of the pandemic a couple of weeks ago, but in recent days has experienced a significant growth is Alexandra itself. In Johannesburg, it's an area of high density, so this is certainly a serious source of concern that dispels some of the myths pertaining to the fact that high density areas are not having the virus. The virus simply goes everywhere where there is people to infect. We have quite a lot of activity in Tembisa and Ekurhuleni is already indicated by the Premier. You can see clearly the number of hotspots. You really have a large area being subjected to the pressure of the pandemic. Another area, southwest and south to Soweto, in Zola, Protea, and Pimville, you basically have quite a number of hotspots, some of them, as indicated by the caller, with a high severity. Another area which is also high density, but now people living in apartment buildings, that would be Hillbrow, Newtown, or Rowville. You basically have, you see clearly the areas. Some of the hotspots are more severe than others, but you can clearly see there is quite some activity in areas that are densely populated. Another area that displays quite a number of cases would be Mamelodi in Tshwane. And obviously these are examples of areas that have high density of population. We strongly encourage the population and policymakers to look at the website, at the tool that is updated at least twice, if not more often, a week. So that brings me to the two conclusions. The first one is that indeed level 3 restrictions, we have enough data now to conclude that it have slowed down the escalation of the pandemic. However, we can't relax. By no means can we relax. We have not yet reached the peak of the pandemic. There's a number of indicators that speak to that effect. And as a result of that, the restrictions need to continue as the transmission is going on and the numbers are still very high. We have now a very detailed geospatial picture of what's going on in the province, and we are displaying to everyone, you please use that link, where the hotspots are, and you can see areas that are both low and high dense in terms of population. You can see that the virus is spreading pretty much everywhere and quite rapidly. And the conclusion here is that we need to abide by the rules and regulations and social distance, wear masks, exercise, physical distancing, and very important, adhere to the restrictions on gatherings. Those still remain essential more than ever. Thank you very much.
Thank you very much, Prof, as well as Doc. Premier, we've got some questions. I don't know if in the room, do we have any questions? Masego? Maybe let's start here. Okay. We've got one there. I think he present. It's fine. I think it is begins. Please proceed.
Thank you. Masego Rahlaga from ENCA. I just have two questions. Firstly, I know that you said that schools at the moment, the education department is concentrating on the marking. I just want to know, in terms of your submissions, if the education ministry does ask for your submissions, are you comfortable with schools reopening in about 2 weeks' time with our numbers looking like this? And then secondly, with the trauma at hospitals, I just want to know, maybe the health MEC will be able to answer this. Is there a budget for trauma? And since there was no trauma, for instance, at Bara Hospital on the 31st, and they sent out that picture with the empty hospitals, are you perhaps thinking that the money, if there is budget for trauma, that budget probably be redirected to helping with other things COVID-19 related? Thank you.
Thank you very much. So I think maybe Premier, we've got 3 questions from Daily Maverick, from Mark. The first one is, in October 2020, The Gauteng Education Department paid 260 million for sanitizing schools. Is the Premier aware of this? Does he consider it justifiable expenditure? The second question from Mark again. Are the APT ICU field hospitals at George Mukari, Jubilee, Kopanong, and CHP now ready to be used for COVID-19 patients? And the last question from him is the Auditor General has now found that the proper tender process were not followed for the ICU field hospitals, despite MEC public claims that they were. Any comment from the Premier or the MEC? Then we've got a question from Isaac Mashango from Sowetan.
Thank you very much, Premier and Vuyo. Good afternoon to the media. I think my question is one on the issue of the trauma budget. The trauma budget, there's no budget that is called trauma budget. We have a budget that is for operational budget. So if at the end of the financial year, we see that there's a saving, we are able to reprioritize, especially during the adjustment budget. But I think the Premier did indicate earlier that because we have to renew or extend the contracts of the frontline workers that were appointed with the contract ending 31st of March. We are currently reprioritizing our budget and check where do we have our savings so that we can be able to extend the contracts of those nurses that were appointed with a contract ending with 31st of March. But the other thing that we're also doing now, we do have in our system what we call the ComServe. ComServe nursing is the nurses that are going for training and they have to come and do their community services. So their contract also ended in December. So currently we're working on reprioritization of the budget to make sure that we retain them, as the Premier have said.
Of this battle, even if they may not be healthcare workers, people in civil society, people in the media, many of who take a risk themselves to discussions at national level. What was Gauteng's input? On overall, based on science, based on the evidence presented by the advisory committee, spoken to by Dr. Mary Kaonga and Professor Bruce Melado. Overall, our attitude was that we should stay at level 3. Moving to level 2 or level 1, reopening again, the science showed, the predictive model showed that would be very, very dangerous. It would make it difficult for us to cope with this. So I'm saying in general, staying at level 3 is something that we would have strongly felt about. I want to leave the issue of the opening of schools to the national. All the provinces made their input. Those inputs need to be based on evidence. All we showed is that in Gauteng, at the beginning of the year, 2021, where we are now, the pandemic is on the increase on all indicators, that the opening of schools needs to take that into account. So what is it that would be the concern of parents under circumstances like this? That every other place, you know, as things stand now, going to the shop is a calculated risk. Going to the work is a calculated risk that you take. Even under those circumstances, you want to make sure that you don't bring the pandemic at home. Coming to a media briefing like this, it's also a calculated risk, depending on the work that needs to be done. The question about the school, we in Gauteng, we have more than 2 million learners. We have more than 2 million young people in our schools. That's not just a small event. And some of these schools have 1,500 children. So even as we dealt with the first wave, the schools were a big concern for us. So we expressed a concern that in the next 2 weeks, whatever decision is taken, we express that it needs to take into account where the situation is. So I don't know what decision will be taken. But once the president announced level 3 remaining, we are happy. We would have been unhappy with going to level 5. We cannot afford to shut down the economy. And that's what is coming, the feedback that's coming from the consultations we have with everybody, including the political parties we heard this morning. You are asking a question, Maseko, on the budget relating to specifically trauma units. Let me tell you that the phase we have entered also requires us to constantly go back and review the budget. I was saying to you earlier on, with regard to additional staffing that needs to be taken, we are going back. That would include also asking the legislature. We are going back to re-look into our budget. Whatever resources are available, we reprioritize. And at the moment, I think the big issue for us is the staffing. Our healthcare personnel is under tremendous pressure. So whatever resources we can mobilize and reprioritize in our health budget and our provincial budget in general will be directed at this. And the second thing is just to make sure that we can continue to increase the number of beds. The other beds is what already we had budgeted for, but here at Nazrec, we had not budgeted for, if we were to add another 1,000 beds. But if the situation is going to require that, we will have to go back to our budgets. We have to, and I don't want to say the discussions we are also having with the national. Every province also does that. But we have to look at whatever resource is there to deploy. And I'm saying at this hour, just to make sure our healthcare workers can cope is the most important focus. Those nurses whose contracts have come to an end, it's our priority to retain them. Those doctors whose contracts and other allied health professionals whose contracts are ending 31st of March, we want to retain them in the system because they will help us deal with the pressure that we are facing. Mark, the good thing with Mark is that he asks the same questions in every media briefing and interaction. Mark, thank you so much for continuing to also just monitor and give us feedback on the work that is happening, but also what your sense is from a civil society perspective. The education PPE, I did say to you, Mark, that issue was being investigated, and that's one of the reports that the investigation is still underway. And several of the, otherwise, those investigations that would have been completed, if they are done, I will be able to give a report on what is going to happen there. I do know that the AG has concluded a report. We have received that report, and that report of the AG is being considered by the provincial government and the relevant agencies of our provincial government. It was released in December, before the festive season, related to the various projects, including the infrastructure projects. So, Mark, all I can say to you is that we are attending to the issues that the AG has raised. But you'd also know that there were other separate investigations, whether on infrastructure projects or on PPE that are ongoing. In our province, once an investigation is concluded, we put a process in place. There are some officials who have already been suspended in a department like the infrastructure development department, and they are going through a disciplinary process just in relation to how they managed the infrastructure rollout portfolio. Some of the delays I was referring to earlier on in my report are also a result of not just disruptions, but also where contract management was not satisfactory. So action is being taken as I speak. As I say, some of those officials were suspended in November, and disciplinary processes are underway. Mark asked the question, are all ABT, that's alternative building technology beds, facilities ready for use? Not all of them, Mark. In my briefing earlier on, I explained some of the action being taken about those is a result of delays, some of which were caused by disruptions. But I can say that the numbers I was talking to, including what we will be able to respond to, the one that's a real setback is Kopanong, Mark, and that's where the provincial government is really acting on matters pertaining to the contractor there. But several, I visited with you, Krisani Baragwanath, the significant work at the Krisani Baragwanath ABT in November. The Jubilee ABT was completed, and the ABT at George Mukari, we've got very tight timelines about one of those that those ABT beds will be ready. But let me say to you that simultaneously with completing the infrastructure is having the personnel. And that's one thing that the acting HOD and the MEC keep coming back to us on. Completing, we want to make sure that all these projects are completed, and the ABT projects, excluding the one that has just grounded to a halt, and we are instituting legal action on it, that is Kopanong. The others are on track. There's a significant ABT beds that have been added, and I explained that just by in the next 2 weeks we will get 375 of those ABT beds added in addition to others. And ready for use is important, Mark. Ready for use means you also have the personnel. And that's why we cannot release the healthcare professionals that we had contracted for COVID. We can't release them. We are reprioritizing our resources to be able to keep them in the system. So I will be able to, Mark, keep in contact with you, also indicate once we have completed our course of action, what's called consequence management on the Aegis report. Once we have completed that, we have started it, as I say, there are officials who were suspended in infrastructure development, and disciplinary process is underway. Once we complete that process, we will be able to give an update. Isaac Matlangu, when will NASREC be ready for use? Isaac, as we speak now, NASREC is ready for use. There are 500 beds, critical care beds there, and 500 quarantine beds. And then another 500 is being added after we took a decision this week. That decision was taken this week. That 500 that we had offloaded, that's 2 days, takes 2 days. The HOD assured me this morning that this additional 500 beds will be ready in 2 days. The other additional beds, which we said, we are looking at the trajectory of the pandemic. We are really intent on ensuring that we even go to an extent of adding. That may take a bit of time because the infrastructure rollout and connecting, and we monitor, to do that, we're monitoring exactly the behavior of the pandemic. What accounts for the slight reduction over the past 2 days in the numbers? You remember that's a national trend, that at the high point in the second wave, we reached almost 22,000 cases nationally. In the province, we reached 6,900, almost 7,000 cases a day. That's a few days ago, on Friday. So you're asking the question, yes, but you can observe that there's been a slight drop. That's 17,000 and 15,000. In the last 2 days, 17,000 and 15,000. All I can say is that we are cautioned by our advisory committee that we mustn't celebrate too early. That it is too early to think the pandemic is still raging, especially here in Gauteng. The pandemic is still raging. People have just only arrived. We expect that whilst it's a good thing to have fewer infections, it is a good thing. It's also a good thing to have observed a reduction in hospital admissions just over the last day or so. It's a good thing. But the wise thing to do is not to start saying that we are going down. We are not at the peak. It is possibly the Eastern Cape and closely the Western Cape that can talk about reaching the peak. And KZN has also been in it for a while. So Baba Mahlangu, you say what accounts for this? Maybe Bruce may be the best person to answer. All I will say is that even if the numbers are less, as we see the numbers being, it's always a good thing when fewer people die, fewer people are in hospital, and fewer people get COVID. So it's a good thing. But we mustn't think, oh, suddenly we need to relax or be complacent. I will say, let's give it a big push. And it's sometimes better to expect that the West is still coming so that we prepare ourselves, psychologically we prepare ourselves. When we get to the peak, we can then say, see, our modeling team says, the peak will not be where we are now. We are still at 50,000 daily infections, active cases. We are still at 50,000 active cases. We're going to get to just slightly over 100 active cases over the next week or so. At which point will that peak also depends on the impact of level 3 and the work that the communities themselves are doing to help stay away from trouble, basically. Help stay away from trouble and help contain this pandemic. So it is still too early, Isaac. Maybe when you look at a 7-day average, only after 7 days, because the pandemic modeling is often 7 days give us some good sense of a trend. So if over 7 days we would have seen a decline in the national numbers and a decline obviously in a province like us, I will say over 7 days, I'll say I'm really, really noting that there is a very positive development. But if it's still 2 days, it is still too early. 7 days are better to help us to see the trend on this note. So thank you so much, members of the media. May we continue ourselves to do what we say needs to be done and be safe. Thank you so much.